If you're over 70, and you've noticed your legs feeling heavier at the end of the day, or a strange tingling that comes and goes, or skin that looks a little different than it used to, please don't scroll past this video. What I'm about to share could be the difference between catching a serious problem early, or missing warning signs your body has been sending you for months, maybe even years. Stay with me, because by the end of this video, you'll know exactly what to look for, and more importantly, what to do about it. Let me tell you about a woman named Carol. Carol was 74 years old, active, sharp as a tack, still gardening every morning and walking her little dog around the block twice a day. She noticed her left leg felt a bit cooler than her right one. Just a little. She figured it was nothing. Maybe she'd been sitting funny. Maybe it was just getting older. She brushed it off the way so many of us do, because when you're busy living your life, a small symptom doesn't feel like something worth stopping for. Months later, that small coolness turned into something much more serious. A blockage in the blood flow to her leg had been quietly building the entire time. What started as a whisper became a shout, and by the time she got help, the treatment was far more complicated than it needed to be. I'm telling you Carol's story not to frighten you, but because her story is far more common than most people realize. Poor circulation in the legs, something doctors often call peripheral artery disease, affects millions of Americans over the age of 70. And here's the part that should really get your attention. Many people who have it don't even know. It doesn't always come with dramatic pain or an obvious emergency. Sometimes it creeps in quietly, disguised as things we blame on simply getting older. Tired legs, achy feet, cold toes. We tell ourselves it's just age. But age alone doesn't explain everything, and dismissing these small signs is exactly how serious problems get missed. So today, we're going to walk through the hidden signs of poor leg circulation that doctors want you to know about. Some of these might surprise you. Some of them you may be experiencing right now without realizing what they mean. And by the end, I'll share what you can do starting today to protect yourself and the people you love. Let's start with the most overlooked sign of all, and that's leg pain that shows up only when you're walking, and then disappears when you rest. Doctors call this claudication, but you don't need to remember that word. What you need to remember is the pattern. If you find yourself walking to the mailbox, or through the grocery store, and your calf muscles start cramping or aching, and then that pain eases up once you sit down for a few minutes, that is not just a normal sign of aging. That is often your muscles telling you they aren't getting enough oxygen-rich blood while they're working. It's like a car engine that runs fine when it's idling, but starts sputtering the moment you press the gas. Many seniors quietly adjust their whole lives around this. They stop walking as far. They take more breaks. They tell their spouse they're just tired. But this pain has a message, and it deserves attention, not adjustment. The second hidden sign is something most people would never connect to their legs at all, and that's changes in skin color or texture. Take a moment sometime today, maybe right after this video, and really look at your lower legs and your feet. Are they pale, or slightly blue, especially compared to the rest of your body? Does the skin look shiny, or unusually smooth, almost like it's stretched tight? Has the hair on your lower legs thinned out or disappeared completely? These changes happen because when blood flow slows down, your skin and the tiny structures like hair follicles are often the first to feel the effects. They're getting less of what they need to stay healthy, and over time, that shows up right there on the surface, visible to anyone who takes the time to look. The third hidden sign, and this one catches so many people off guard, is a wound or sore on your foot or lower leg that just won't heal. Maybe you bumped your ankle on the coffee table weeks ago, and it's still not closing up the way a cut normally would. Maybe there's a small sore near your toe that keeps scabbing over and then opening again. When circulation is compromised, your body loses some of its natural ability to repair itself in that area. Blood carries the nutrients, the oxygen, and the immune cells your body needs to heal a wound. And if that supply line is restricted, healing slows down dramatically. This is one of the most important signs on this entire list, because a wound that won't heal isn't just uncomfortable. Left unaddressed, it can lead to infection, and in serious cases, it can threaten the leg itself. If you have any sore on your foot or leg that has lasted more than a couple of weeks without improving, that is worth a phone call to your doctor, not a wait-and-see approach. Now let's talk about something that happens mostly at night, because this fourth sign trips up so many people. It's cramping or aching in your feet while you're lying in bed. That actually gets a little better when you dangle your leg off the side of the bed or sit up. This might sound strange, but there's a simple reason behind it. When you're lying flat, gravity isn't helping your blood get down to your feet anymore, and if your circulation is already struggling, that can cause pain or a burning sensation, especially in your toes and the balls of your feet. Some people describe it as their feet falling asleep. Others describe a deep ache that wakes them up in the middle of the night. If sitting up or letting your leg hang down brings relief, that pattern itself is a clue, and it's one worth mentioning to your doctor rather than just accepting as part of getting older. The fifth hidden sign is something even many family members miss, and that's one leg or foot feeling noticeably colder than the other. Not both feet being cold, which can simply mean you need warmer socks, but one side being distinctly cooler to the touch than the other. This kind of difference between the two sides of your body is often your circulatory system telling you something isn't balanced. Blood isn't reaching one limb as effectively as the other, and that temperature difference is one of the clearest physical clues you can check for yourself, right at home, with nothing more than your own hands. The sixth sign is thickened, brittle toenails that seem to grow slower than they used to, sometimes taking on a yellowish tint. Just like your skin and hair, your nails depend on a steady supply of blood to grow properly and stay healthy. When circulation slows, nail growth often slows right along with it, and the nails themselves can become weak, discolored,